I'm with Benjamin Maughan from the Huntsman Cancer Institute, a GU medical oncologist. He was just chairing a session at World GU 25 talking about MRD and GU tumors. Is there a role for MRD in prostate cancer?
In terms of prostate cancer, it's tricky in terms of MRD testing because we already have that test, the PSA. It's nanograms, right? It's a millionth of a gram in just a milliliter that we're detecting. So it's an incredibly exquisitely sensitive test. It's hard to build on that. There can be more utility once we start looking at the data in the later lines of the disease, like castration-resistant prostate cancer. But in terms of MRD testing, patients that have a diagnosis of localized disease, and that's tricky and hard to build on. There is some important work looking at that because PSA is not perfect, but compared to other cancers, it's important to remember we already have an MRD test in that space.
So what about kidney? What do you think is the most promising?
KIM1 seems to be the most promising. We have a lot of data sets that KIM1 has been retrospectively analyzed in, and very consistently across each of those prospective clinical trial data sets, it's consistent results. The other huge advantage is that a lot of the MRD type technology that we've used in other cancers is genomic based. There's a huge sensitivity issue with those technologies in kidney cancer, whereas the proteomic based test, KIM1, seems to be quite sensitive.